Former Governor of Nevada, Kenny Wynne, once said, "Children who are victims of neglect, abuse, or abandonment must not also be victims of bureaucracy. They deserve our devoted attention, not our divided attention." Unfortunately, in this day and age, Child Protective Services often fail at providing safety, permanence, and well-being to our most vulnerable of kids. One needs only to look at the statistics surrounding foster kids to see the glaring inadequacies of CPS interventions. These children are found to have 3 to 7 times more emotional disorders and chronic medical conditions than children of similar socioeconomic backgrounds that remain in the home. They are also found to have disproportionate rates of developmental delays. Children removed from the home are also more likely to engage in risk-taking behavior, likely to land them in state and federal prisons, representing an average of 23% of inmates across our country. While these trends may shock and dismay the public, solutions to child abuse and neglect remain elusive, and billions of federal expenditures are spent on a system that is failing its clients. Under Title IV-E of the Social Security Act, funding for foster care is open-ended, and annually the federal government shells out upwards of $9 billion to CPS, group homes, and foster families. This allotment of $9 billion doesn't even begin to take into account the publicly subsidized money spent on health care, food stamps, or cash welfare needed to provide for these children, or the $5.1 billion it costs to incarcerate the former youth that wind up in the criminal justice system. It is clear to see that not only is it a moral imperative to encourage child welfare reform, but a fiscally responsible one as well. So where do the solutions lie? As with all good plans, in order to look forward, it is essential to first look to our past to garner a better understanding for the historical legacies that have been compounded to create our current experiences. For brevity's sake, we will divide the history of child-saving institutions into 3 eras. In 1792, the first American institution for neglected, dependent, and delinquent children was formed as an alternative to housing vulnerable youth in almshouses. Over the next century, orphan asylums, houses of refuge, and reformatories sprouted up across the country, offering shelter, routine, and structure for needy children. To those running these organizations, most important was the isolation from the moral depravities of their impoverished parents and to prevent the spread of their pauperism. In 1874, the New York Society for the Prevention of Cruelty to Children, or SPCC, was formed as a reaction to the well-publicized case of a young girl being brutally beaten and neglected by her stepmother. This case marked the first criminal prosecution and intervention of child abuse and neglect. By 1922, around 300 non-governmental societies followed suit in their crusade to protect priceless and vulnerable children from their cruel parents. These rescued children were placed in predominantly institutionalized settings until a shift was marked during the Progressive Era, when the Children's Bureau was established to deliver services in more family-like settings. So became the birth of the foster family and the decline of non-governmental SPCCs. The shift to purely governmental agencies organizing child protective services was marked by the 1962 amendments to the Social Security Act. Child-saving institutions were now federally funded as a part of child welfare services, which would be administered on a state level. This was also the year that legislation was passed requiring doctors to report suspected abuse. This led to an increase in foster care placements, now considered the preferred solution to child abuse and neglect. Today, around 500,000 children are in foster care at any point in time, and 30,000 of these children remain in the system until they age out at 18 or 21.
Okay, so now that we see the current function of group homes in the foster care system, how can we address the issues through policy change? First, we need to consider who we think belongs rightfully in group homes. For children who have experienced unsuccessful foster care placements, we would suggest what we call kindred care. Kids who have run away multiple times, kids who have been abused or neglected by their foster families, and kids who have bounced around from home to home with little hope for permanency planning, all could benefit from the stability, community, and support of these newly envisioned versions of group homes, kindred care. By making these distinctions, we do not aim to recreate outdated delineations of deserving and undeserving. Instead, we aim to create an additional option to honor the highly individual and specific needs of foster children. Specifically, we hope to encourage more autonomy and agency in this vulnerable population which has previously held distinctly little control over such impactful aspects of their lives. We would hope that this would engender some so-called buy-in or renewed faith for children who had otherwise been failed by the system. What's more, we would offer Kindred care as a residual service, a last resort, because we would want to encourage youth to first attempt to experience more traditional home and family life in a foster setting that might allow for the most healthy attachment style and the greatest sense of normalcy or belonging. So how would we change from the group home model to the Kindred care model? We would not only alter the client-directed process of self-selection for group homes, but also the programming in Kindred care. We would, in an imaginary world, have exclusively trauma-informed staff with a ratio of no more than 5 children to every adult resident parent. Kindred care would function on a cooperative model both for the residents and for the staff. To maximize efficiency in services and funding, we would place Kindred care residences in row house or apartment-style units similar to low-income units subsidized by HUD. 2 to 4 residential units could be coupled with one administrative or central office. This would mean that 10 to 20 children could rely on the same administrative staff member to provide access to the housing, process necessary paperwork, and be responsible for scheduling official meetings that coordinated their care. Also in the central office would be a mental health professional who would become a member of the residential staff and would have regular interactions with the children and, quote, resident parents. Each Kindred care resident parent would develop a connection with each of the 10 to 20 residents, although the adult living within each unit would likely form the closest bond with the 1 to 5 residents of his or her own unit. The presence of multiple familiar adults would add security and stability to the lives of the residents, as well as a sense of justice if a disagreement occurred between one resident parent and one student. Additionally, the presence of multiple adults allows for self-care to occur for these adults by allowing them to have off time during which they can be sure their own 5 residents are in good hands with other, quote, parents who already know their residents. These aspects of multiple parents, off time, justice, and security are often absent in foster homes. What's more, these adults would be clinically and are professionally trained to work with foster care youth, which is unlikely to be the case with foster parents. The cooperative model would allow for the Kindred care resident parents to be stakeholders in the success of the programming for the children and would give the people most directly involved in day-to-day affairs the capacity to adjust programming as they saw fit. Likewise, a cooperative model would exist for the children. An allowance system would give them money to spend or save as they saw fit in order to reestablish for them a sense of reward for chores or participation in community life, as well as to offer them some level of control to fulfill their own wants and needs. Funding for these services would come from both state and federal sources, and much would be drawn from the current foster care system away from the placements where these children with this level of adverse experience would have gone. The institutions would certainly be nonprofits, and part of the added benefits for trauma-informed, clinically trained resident house parents would be included room and board.
So what can we do as social workers to work towards the goals represented by Kindred care? First, social workers should lobby for policy reform surrounding foster care. As a profession, we can see the glaring inadequacies in the lives of foster care youth and use the narratives of our clients as evidence that the system is obviously failing. As social workers, we can not only lobby for reform, but be a part of the creation of innovative and new models of care that represent the values and ethics of the National Association of Social Workers. To us, Kindred care represents service to our youth, a promotion of social justice for those who fall through the system's cracks, an acknowledgement of the inherent dignity and worth of each youth, an emphasis and reliance on the importance of human relationships, this one is big in our model, integrity to our children and ourselves, and confidence as trauma-informed clinicians. Most important, to appeal to the autonomy of the client and honor the client's role in self-determination, we can ask our clients what works for them and modify our recommendations in accordance. People always say that children are our future, but maybe it's time that we acknowledge that children can also be highly influential in our present. With their experiences, narratives, and imagination, we may be able to change the lives of the 30,000 kids stuck in foster care drift.